No. Anyway, so the idea of defining key risk indicators and then looking at the results to see, well, which sites, which key risk indicators were showing up, the red and green and yellow, the typical traffic lighting. But most interestingly, what's going on over time? How are all of the sites doing over time? The little ducks whiskers distribution, and when you click on one of the sites to see how that site's doing over time with the threshold areas. But part of the thing also, and this is a touchy subject. This is we've added a capability to add define suggested actions. And we tried to emphasize the word suggested. So it's one of those things that you can build in, and I think many of the systems do something like this, that where you can build in key risk indicators and thresholds, and if a site triggers a high risk indication, you can also then specify a particular site suggested action and maybe some additional comments, and that's good for consistency and a central group that's defining things and sending suggested actions out, and then being able to close the loop and saying, okay, well, yeah, I saw that, and this is what I did. So that's all nice, and then to see the actions taken when they were, and so on. And of course, also an important, and I think that it's very much present in the other systems. If you see an issue, a high risk indication, you click on it, see which patients are behind that, take a look at, drill into the related data, whether it's by tabular profile and so on. So all of those things are good, but again, that's based on looking at things that we had thought about as potential key risk indicators, areas of concern, things that you think might be indicators of quality issues, potential fraud issues at the site. But it's the other stuff that is especially interesting to see. Well, what else is lurking in the data? And then that's what the newer area that we added a couple about two versions ago. We call it, as I mentioned, data quality analysis, which is a unsupervised capability, and it does automated data quality analysis without having to tell the system what to look for. It's just to say, okay, have at it, go to it, see what you think. Very much similar to some of the other presentations that we've seen before, to say not having to specify which tests, which variables, which thresholds, but rather use a variety of statistical. In our case, we're currently only using a variety of statistical tests and some other things, other checks to consider. We're not yet adding machine learning, but we're planning on adding that. But the interesting thing is, after the analysis happens, you can review the results interactively, of course. But the interesting thing that I think might be a little different than others, a different way of looking at the final results, is we kept seeing the different results in terms of Mahalanobis distances, or different inliers, outlier detections, and correlations, all kinds of battery statistics, but also other types of metrics, such as number of serious AEs or dropout rates, or things such as leading or trailing digit preferences, a whole battery of checks, of some statistics resulting in p-values, some just resulting in rates, others. So it's sort of a grab bag of tests. And we said, well, you can't really combine p-values and these other things. So what we came up with is the notion of a global score, which in a sense is, you might think of it as demerits, and I hate to use that term, but that in a sense, what we do is, after we run a whole battery, and this is a battery of the different types of tests we're running, some of them are resulting in p-values, some of them are resulting in rates. Um, but internally, then we have thresholds of what's considered an area that you would consider potentially negative of any of these tests. And so if the global score is essentially counting up any of the tests or rates or anything else that we're checking, if that is in the area that would be considered negative or not a good result, we count that as a demerit, and then total up the demerits, just like, well, the military, and then that's the global score. So it's a simplistic way of just coming up with an overall number, but a way to combine the different disparate statistical tests and other types of tests like SAE checks and so on. And then present that in the form of a tree map with the darker the color, the higher the global score. So you can click on that to see the rates of that. And this is, it's important also to say, well, you can turn on or off some of the checks depending on your preference if you don't want to bother with those, and also change the weight of each of those. So in terms of if they're all initially a weight of 1, they'll all count as an equal demerit. But if you think certain things like inliers and outliers should be more heavily weighted, you can do that, and that's an important aspect. The other thing is that we wanted to say, well, why don't we add some other things in addition to picking up, number discontinued patients and relative rates of discontinuation or serious AEs and so on. All of that stuff is defined here, but and the weights and the which tests you want to do, and if you have a geographic distribution of country and so on, but also add define tell the system which piece of information that are being collected could potentially lead to determining whether it's a potential duplicate patient. Things like date of birth, gender, race, and so on. So you can define all of that, because that's another piece of information that comes through. That's where so you can just check which things and also that's in the patient information column. And you can, if you want to, limit the search. By default, everything is selected, but you can say, oh, don't bother looking at certain fields and so on. But the duplicate patient information is important. And then after it runs and you see the results and the overall global score, you can also dig into individual countries or sites or data distribution and digit preference and so on.